Nurses at the University College Hospital in Ibadan have joined a nationwide strike called by the National Association of Nigerian Nurses and Midwives due to unresolved issues with the federal government. The strike, which began on July 29, will end on August 5, with the hope that government will meet their demands. However, if their demands aren't met, the nurses have threatened to issue a 21-day ultimatum and potentially escalate to an indefinite strike. Their key demands include immediate gazetting and implementation of the 2016 Nurses Scheme of Service to guide their profession. Speaking with newsmen after a closed-door meeting at UCH, the chairperson of NANNM UCH chapter, Fumilola Faminu, said the decision to fully comply with the national directive was unanimous.
Yes, our conclusion is that we are commencing the 7-day warning strike as directed by the national headquarters of the Nigerian Nurses and Midwives, consequent upon which the federal government did not accede to our demands. So we are commencing the 7 days warning strike.
What are your demands?
Okay, yes, employment of more nursing personnel, and provision of adequate facility for the hospital, for our various hospitals, for our various institutions. We want a directorate cadre for nurses at the Federal Ministry of Health. We want fair representation of the association at the Federal Ministry of Health. We consultancy for nurses and midwives, gazetting of the nurses scheme as established by the NCE in 2016. And then centralization of internship training for nurses. We also want a review of the allowances for nurses and midwives. Nurses provide compassionate, competent care across all settings. It is rather sad that we have to recourse to this, but we have no choice, and we appeal to our patients, our clients, that this is a just cause that we are fighting for. We are going to still engage with the government, and if our demands have not been met, then we issue a 21-day ultimatum, and then we proceed from there to an indefinite strike.
The Federal Ministry of Labour and Employment had earlier convened a meeting with the association, but talks ended in a deadlock, prompting the industrial action now affecting public hospitals across the country.